Hi, I'm Dr. Trudy Gores, and today we're going to be talking about gallbladder disease and gallbladder surgery. People who come to my office with gallbladder disease usually are complaining about symptoms such as nausea, epigastric pain, right upper quadrant pain. Sometimes that pain will radiate to their backs. Sometimes there's a family history of gallstone disease, and other people have absolutely no other history and very vague atypical symptoms, but those are things that we try to elucidate here in the office. In terms of why people are feeling like they're having gallstone problems, an ultrasound is usually the first test that will be gotten, and most people do have gallstones, but even in people who don't have gallstones seen on their ultrasound can have something called biliary dyskinesia, where their gallbladder simply doesn't work. Symptoms such as nausea and vomiting and the abdominal pain that is caused by gallstones can be explained as follows. In most people, this is their upper GI tract, their esophagus and stomach, and this is how food passes through their system. This is the pancreas. He makes some digestive juices that empty into the system to help digest the food here. And then this is the liver, which lives up under your right ribs, and this is the gallbladder underneath the liver. The gallbladder, as you can see on this picture, if it does have stones, are sitting usually in the bottom of the gallbladder. The function of the gallbladder is a bile storage facility. Your liver makes bile. Some of that comes here into the tubules and comes in and mixes with the food in your intestines here. Some of it comes into your gallbladder for later use. When food is entering into the stomach, and here you have some pizza, which has a very high fat content, entering into the stomach, there's hormonal communication that happens between the stomach and the gallbladder. And the stomach will tell the gallbladder that there's going to be a high fat content coming into the intestines here, and therefore more bile is needed to help to digest that food. The gallbladder therefore will contract, emptying more bile into the system here. However, during that contraction, one of the gallstones can get displaced and actually get stuck, and thereby keeping the gallbladder from emptying any bile into the system. When that gallstone gets stuck and the gallbladder keeps trying to contract, that actually can cause pain because it's actually spasming, but also the gallbladder can send a message back to the stomach saying that something is wrong in the system, and therefore sends a signal back to the stomach for the person to feel nausea or to get rid of the stimulus, which is the fatty content, and the person will either vomit or some of that undigested fat goes and empties out of the stomach, causing diarrhea because the body wants to get rid of it. Unfortunately, if that stone does leave the gallbladder and actually makes it into the ducts that are leading into the intestine, even worse consequences can be had. If a stone is getting stuck here in the duct, you can have some backflow of bile into the liver, which then can actually get back into the bloodstream, causing jaundice or yellowing of the skin. And even worse, if a stone is actually making it further down into the system and blocking the pancreatic juices from entering into the intestine, you can also have devastating consequences such as pancreatitis, which actually can kill a person. So certainly if someone is having symptoms of upper abdominal pain, right upper quadrant pain, has an ultrasound showing gallstones, we suggest that you have that gallbladder removed before any of these other more devastating outcomes can be had. And how gallbladder surgery occurs is usually, in most people, a laparoscopic procedure. Laparoscopic procedure is done under general anesthesia. You're completely out, and there are 4 small incisions made on the abdomen. The belly is then filled up with air so that we can actually see the structures that we're operating on. And here again, now you can see the liver, the gallbladder with the gallstones. And our goal during this procedure is to identify this small connecting duct and place these green clips, as you can see here, and a small artery that also comes up onto the gallbladder must be clipped. We want to preserve the integrity of this duct actually carrying the bile from the liver into the intestine because we still want your food to be digested by that bile, but we want to get rid of your gallbladder or the storage facility only. Once we actually have these structures clipped off, we'll divide them and shave the gallbladder with all the gallstones out from underneath the liver, place it into a little baggie, and take them out through this incision right up underneath your breastbone. When all that's complete, we'll evacuate all the air that we put into your belly, put some numbing medicine under each of those small incisions, and then close them with degradable stitches and place some super glue over the top of those so you don't have to worry about bandages or band-aids. What's life like without your gallbladder? If you don't have a gallbladder, your liver is still making bile, and that's being delivered into your system. Again, you just don't have a storage facility. So high-fat foods like pizza, bacon, anything fried like fried chicken can cause you to have some cramping and some possibly diarrhea. It's really a vastly small number of patients who have long-term diarrhea after their gallbladder removal, but that can be something that in the first month or so after surgery can happen. We usually will see you back in the office about 4 weeks after surgery to make sure your incisions are healing, you're eating okay, hopefully diarrhea is not an issue for you, and then hopefully get you back to normal activity. Depending on your work, you can go back to work anytime that you feel that you're ready. If you have a lifting restriction due to large incisions, if you have a lot of gallstones removed, we'll talk about that immediately after surgery so you know what your restrictions are. And then hopefully, after approximately 4 to 6 weeks, you're forgetting that you ever had this surgery, you're feeling well, and you're getting back to a normal diet.